Hi everyone, welcome to another Facebook Live with the CBC. I am Kas Rousy. I am a health reporter at the CBC, and today we are speaking about back to school. It's happening next week for several thousands of young Canadians, and you'd think that you'd only have to worry about whether they got the right school supplies, but unfortunately there's a new thing happening, not so new, but a growing problem, one that has been called an epidemic. We're talking about the opioid crisis, and someone that knows a lot of information about it all too well is my guest here today. She is a Toronto family physician. Her name is Dr. Sharon Cirone. And Sharon, just to get this straight, you focus on addiction and mental health, especially when it comes to young adolescents.
Yeah.
Now, I asked you this earlier. I'm obviously been out of school for a few years. I never thought that I would be talking about back to school and opioids. Is this the new normal?
Well, I think talking about caution around alcohol and substances is not a new normal for adolescents and young adults returning to school. My son just, my husband and my son packed up yesterday, packed up the back of the car and drove off down east for him to go to his first year of university. And my daughter's off to university as well. And so the first week is often an orientation to school activities, and which is often an introduction to party. So the consumption of alcohol and the safer consumption of other substances has been top of mind for quite some time, decades. Certainly when I was going to university, it was also an issue. The substance of concern right now is opioids. It is the second most commonly used illicit substance by young people in Ontario, and this is from a student survey. And the difference here is that we're talking about a substance that comes behind the frequency of use of marijuana, and then before that would be alcohol. Where marijuana doesn't cause the outcomes that opioids do, there's grave concerns with what's happening with opioids, and as we know, there's been a lot of deaths.
You know, you told me an interesting story yesterday when you were saying to your son, don't even take one Advil. Mm-hmm. Talk to me about that. Like, man, that's becoming scary now. You've even cautioned your own kids, don't take anything from anyone.
Yeah, so my son and my daughter have grown up in a home where this gets discussed because it's my line of work. So, and they're in that age group. So we talk about what they notice amongst their peer group, and I talk about what I notice in my work. So we've had many discussions about the consumption of alcohol and other substances. And the line that we've come up with at home is, well, certainly there's always the option to say, no thanks, I don't do that, or I'm not interested in that, or it's not for me. But beyond that, the other harm reduction responses might be, and what we've learned in our house and what we tell our son, and he's brought out to his friends as a word of advice, is no pills, no powder. We live in an era where you can't be safe with any of these products. Even pharmaceutical pills, or things that look like pharmaceutical pills, may in fact just be illicitly pressed fentanyl. And so I tell my son, I go as far as to say, don't even take a Tylenol, don't even take an Advil from somebody else, unless if you've purchased it from the pharmacy and opened and cracked the seal yourself and know that it came from a pharmaceutical company, you can't know that it's illicit or not. And it's one pill away from death.
No kidding.
Mm-hmm.
All you have to say is no thank you. We've got a question from Blake Haley, and he comments, whatever happened to metal lunchboxes and playing marbles at recess, which is what we were just talking. I mean, it's like it's the new normal now. Gordon Bullivant asks, why are these kids doing drugs?
Well, for the same reason we did all kinds of things in our youth as well. You know, it's curiosity. It's the way that the adolescent brain is structured. And thank God, because if they didn't try new things, they'd never move out of my home. They'd never meet a partner or find a new job or a new pursuit or whatever it is that we get curious about. And along with that comes curiosity about substances, about the use of alcohol, about the use of pills and pot and so on. So that curiosity is just inherent to the human system and the developing changes of adolescence. So, and the opportunity to use a pill is what's around. We have an epidemic of prescribing in this country, and so there's more than enough of them around, and the illicit market has realized the opportunities here. So the dealers and the manufacturers and the pressers and the so on are in on this, and we have an abundance of pills out on the street. So what's available, and you match curiosity plus availability, and you've got use. The difference here is a substance that kills people.
Exactly, because we're not talking anymore about just like a prescribed oxy or anything. We're talking about something that's laced with fentanyl or carfentanil now, and they're using all kinds of synthetics to sort of just heighten the effect. And as you say, one pill and that could be it. That could be the overdose that does you in. William A. Jennings is asking, what can parents like yourself going to do to protect your children?
So as a parent, you know, I'm a parent with slightly more information and experience because it's my line of work. But as a parent, I talk with my kids, try to keep the communication open and non-judgmental. I actually also talk with their friends. My kids are used to rolling their eyes when I'm leaning into their friends and saying, no pills, no powder, as I send my son out the door, or as he walks out the door to go to his parties. You know, my daughter's a little bit older. She's been around for the message a little bit longer, and she's in a slightly different environment, so slightly different nuances there. It's about creating awareness and understanding of what's going on. Number two, creating a non-judgmental environment for them to bring this information home and to ask us about things. And number three, in this day and age, when we're talking about the possibilities of death, is to actually try to equip them with some tools to deal with this. So to be able to talk to their friends in an open and non-judgmental way themselves, and to provide that support to their circle of friends. But I must say, my daughter, who has a curiosity about all of this, so perhaps she's a little bit in a different place from other young people her age. She's 21 years old, and when we first started discussing this and the possibility, I actually told her about seeing someone in her school environment as a patient. Didn't disclose to her who it was, of course, but that this person had been using opioids and was not a regular user. Many young people have not progressed to dependent or addicted use of a substance, including opioids, but many use them recreationally, sporadically, intermittently. And I was telling her a story of a young man that was in that situation. I said, you never know, you never know. And she said, oh, Mom, not my friends. However, with conversation and curiosity, she decided to go and get a naloxone kit from a pharmacy. And so she now has a naloxone kit in her possession, that if anybody around her ever is harmed by opioids or is at risk of overdose and death, she can have the tools to help them. I'm
going to ask you about naloxone later, because that was another interesting story, and it's something that maybe our audience should know a little more about, the antidote to an overdose. Mike Person asks, why are we not asking Big Pharma why they manufacture more of this stuff that is legally prescribed? Interesting.
Why, sorry?
He's asking, why are we not asking Big Pharma? Why are they manufacturing more than is needed, more of this stuff than is legally prescribed, right?
Well, I think we know the answer. I don't think we need to ask them. They want to make money. That's the business they're in. Right? So I think there is a lot of questioning of the pharmaceutical companies. As we know, there's a class action suit in the United States. It's also been discussed here in Canada. Whether or not they'll actually be held accountable beyond paying out fees and fines, I'm not sure. We need to continue to ask those questions. It's great that he's asking that. We need to continue to ask that. We need to hold these systems accountable. We also need to hold physicians accountable. It's taken us some time to catch up as medical societies, but we are. There's a tremendous amount of education that's going out now amongst physicians to hold themselves accountable for their own prescribing behaviors, but also to be aware of the opioid crisis, to identify it amongst their patient groups and in their communities, and to be able to equip themselves and their patients and their families with ways to protect their loved ones.
Interesting question here from Deborah Edgerton. She's asking, if we take money away from teens, would this help?
No. And we shouldn't be taking money away from teens. I mean, ideally, it's money that they're learning, that they're earning on their own, and that they're recognizing the value of. I don't think we should take away the skills and the stages of development that teens need to go through. They need to learn how to responsibly and ethically manage their lives, what they purchase, what they avoid, the decisions that they make. This is part of the arc of the developmental stage of adolescence and early adulthood. We have to go through this, and we have to fall down and make our mistakes. You just don't want to fall down and not get up again. We're dealing with something very different here. You can smoke pot or have a drink and make mistakes and learn from it. You don't learn from death. You leave a lot of people with a lot of sorrow.
Good answer. Carrie Bennett says, I feel like we're lacking in educating the public in the real fact that addiction is a disease. Once the body becomes altered, the brain never forgets, and maybe if the public understands this, taboo will stop.
Yeah, thank you. There's a lot of stigmatization when it comes to substance use. People choose to have a drink, people choose to take a pill, or people choose to smoke a joint. People don't choose to become addicted. I don't think I've met anybody who said that they had a childhood aspiration or a young adult aspiration to be an addict. And so once use progresses into dependence and perpetual use despite harms in your life and harms to your loved ones, and into addiction, this is where the disease is present. And some people want to argue that it's not a disease. We can agree to disagree or agree to agree whether we use the word disease or not. There's a compulsion to it. I believe that it is a disease. There are anatomical, structural, hormonal, physiologic changes that happen in the brain that lead to the repetitive use despite harm. And we would not even dream of treating a young person, anyone else, a loved one, anybody else in society with disdain because they have cancer or because they have diabetes. We do so for people with addiction. And this makes it so difficult for people to come forward and ask for help, but in particular young people. There's so many reasons why a young person doesn't want to come forward to a parent, to a person in authority, but even to their own peers about so many things going on in their life, let alone this territory here. We need a really non-judgmental, caring environment to leave the doors open for young people to ask for help.
Yeah, that's the stigma you were talking about earlier too. Chase is asking, how bad are the drugs in question? Like, what effects should we worry about?
Well, the number one effect, and what's making it to the front of the newspapers, and probably why we're speaking with some urgency about this here today, is death. So overdose by opioids occurs because it sedates the brain. Opioids can sedate the brain. Your breathing levels go down and down and down and down until you're no longer breathing. And without breath, you die. So young people tend to use a variety of substances. They're curious, they're interested, they're trying different things. They don't have equitable access to the LCBO or to other products, so they try whatever's around. And very often they're using other substances that can also be sedating. So very commonly in my population that I see, they're using Xanax, they're using lean, they're using over-the-counter medications. All of these are also sedating, and the compounding effects of the sedation make you much more at risk of overdose and death.
This is on top of perhaps like opioids that they might be taking?
On top of the Percocets, the Oxycontins, the morphines, the hydromorphs. Some of them have even progressed into heroin. Some of them are knowingly using fentanyl. Some of them are very unknowingly receiving this product. So in combination, this is even more serious risk.
Rhonda Gray is asking, with all of the new drugs threatening our teens all the time, how does a parent keep up to date?
I don't think it's a matter of up to date, that you know the names or the jargon of each product. I really think that that's perhaps a curiosity, but secondary information. What's most critical is the relationship, is talking with our kids. So whether this is a discussion about opioids or marijuana, or about what time of night you come in, or whom you're spending your time with, or how much time you're spending on a screen, or what you're eating, or how you're sleeping, these are all parts of the tasks of adolescence and young adulthood that parents want to be involved with their kids about, and keeping the doors open for conversation, and creating a space for kindness and thoughtfulness and patience and reciprocity in the conversation, and recognizing that our kids make way more good decisions than they make bad decisions. So talking to them about what's strong about how they're making their decisions, and not pouncing on what they're doing that's wrong. Certainly not pouncing on a molecule. Parents do not gain points by saying pot this and pot that and pot this. They don't win. The conversation ends, and so when it comes to opioids, where they have even less awareness of what they're talking about, very often, it's a no-win situation to pounce and to look for what's wrong and to judge. So keeping the doors open and creating conversation that respects their right to develop and to try and become adult human beings in the best way that they know how. We still, as parents, owe them structure and stability to make these decisions in the safest possible way with some of the wisdom and experience that we have from life. But we need to respect their strengths to make good decisions on their own.
Emphasize the positive, right?
Yeah.
Patricia McGregor is asking, why is sedation so popular? I think she's referring to what you were talking about, the other types of drugs that kids will take, like the Xanax and so on. I imagine that's what this refers to? Yeah,
I mean, there's broad categories of substances that people choose to use or abuse. You know, there's stimulants and there's sedatives, if you want to have broad categories. And on the sedative side, you know, people like sedation. You know, I might titrate my sedation with a glass of wine. Some nights I titrate it with a lot of sitcoms. Other people titrate it or take in their sedation, you know, on a screen. And this has been known since the beginning of humanity, and it will go on till the end of humanity. I like sedation at night. I like 8 hours of it. You know, sedation is something that human beings do. They can numb out. There's a lot of young people who have mental health issues, anxiety or depression, who don't understand their internal experiences, don't even have a name for it, haven't talked to any mental health professional about it or even their families about it, and they're figuring out the best way that they can to self-medicate their experiences. A lot of people have even more complex scenarios than that. Early life adversity, all kinds of things that happen within people's homes or in society that are very difficult to take in. And as a young adult, as an adolescent, just coming to conscious awareness or even body awareness of some of these things that happen, the toll that early life poverty, violence within the home, adversity within relationships, frequent moves, drop out of school, foster care, multi-generational trauma, seeing mental health disorders in your home, seeing addiction disorders in your home, the toll that that takes on a child's spirit, their body, their mind, their emotions, is untold in our society. We tend not to look at this. And a lot of young adults are grappling with the effects of that, and a sedative goes very nicely with that. To numb out.
It's a lot to process, and they're still at such a young age.
Yeah.
William A. Jennings is asking, as a mother, are you concerned about psychotropic drugs being legalized by Prime Minister Trudeau?
I'm concerned about psychotropic drugs, period. I'm concerned about the effects of psychotropic drugs that we as physicians prescribe. I don't do it lightly, and I do it with a lot of consultation with you know, an adolescent or a young adult or their family members or their guardians. I'm also concerned outside of the pharmaceutical or mainstream delivery of psychotropic drugs, the over-the-counter medications, the herbal medications, but also the illicit substances. So perhaps the question is about legalizing of marijuana.
She does mention THC there. No, he does, William Jennings. He says salvo in brackets or THC in brackets. These are the kinds of drugs that he's referring to.
Yeah, so salvo, he might be referring to salvia, which is a sage product from a plant from Mexico. And THC is usually the references to cannabinoids, and there's a variety of delivery systems for cannabinoids now. You can smoke dried cannabis, you can take it in tinctures, you can take it in edible products. So yeah, sure, I'm concerned about the effects of these psychotropic medications, but across the whole constellation, I'm concerned about the developing brain. We have enough evidence now. I always say to my patients, there's more we don't know about the brain than what we do know. However, there are some things we do know. And what we do know now with really good evidence is that the brain is still growing into the mid-20s. There's a lot of things happening in there. Experientially, anatomically, hormonally, physiologically, there's a lot of things happening in there. The brain's still developing. And this is a precious tool that we have to take with us through the rest of our lives. To interrupt that in our adolescence when we're so busy taking risks and not knowing the long-term outcomes and effects because we haven't lived life yet. This is very concerning as a parent because we now have the living stuff, and we look before we leap, as opposed to when we were teenagers, we're leaping first. They don't necessarily know what this is all going to lead to. So I am very concerned, yes, about the effects of any substances, but I'm also concerned about the effects of what's in our foods, what's in our environment, what's in pollution and so on the developing brain.
Wes Jelski, and I'm sorry if I mispronounced the name, Wes. He's asking, why aren't the doctors better trained to deal with opioid abusers?
Well, great question. Loaded question, because we're human and we're not perfect, because medical school training is not perfect, it's run by humans as well, because we do the best we can, because we are responsible for everything from how the heart ticks to how the brain waves move and how the toe wiggles, and so there's a lot of responsibilities. Perhaps that sounds a little defensive, it probably is.
You probably are asked that a lot though, because people get so enraged and mad. They see the headlines, one more kid dead, so they're wondering, why aren't you doing more? I'm sure
we live in a society where we want to point fingers at systems. We should hold systems accountable. We should hold physicians accountable. We should hold our education systems accountable. We should have conversations and collaborative discussions in order to do that. So it's a great question. It's very important. We're working really hard. I mean, I'm taking this interview, I'm spending this time with you on a Friday afternoon, because education of my partners, physicians, as well as the general public, other parents and the kids, is really important.
And I thank you for talking to us, but there are more questions here. Renee D asks, should the medical community be more accountable for the opioid dependence? Maybe that's a bit like the question before, I'm not sure, but...
It's a slightly different question. Yes, I do feel that we should be accountable. We are trying to be accountable. I'm sitting here in this moment trying to be accountable, and it's a very appropriate thing to ask, and I'm hoping we continue to learn and educate our partners in medicine, but also in nursing and other frontline workers, teachers, police officers, and parents in our own homes. Even those who are not getting a paycheck from anybody or accountable to any professional body, all of us can take responsibility in society. And I think the number one thing, we can arm ourselves with a lot of information and knowledge about how does this opioid work and how does that work and what is the medical response. We can all, however, take responsibility for standing back and taking an approach that is less judgmental, kinder, more patient, and giving room for these conversations in our own homes, within our own selves and amongst our own friend groups and peer groups. So all of us ultimately can take responsibility. That's not to deflect from the medical profession taking responsibility.
Wes, who had just asked the question about opioid abusers, is back again with another question, and he's saying, why isn't, and I asked you this yesterday, or why isn't there more recovery facilities available across the country for such an epidemic problem?
Because I understand the passion and the concern that people are showing for the people who are suffering, those who have died and their family members, and all of us in society who are worried about this. Systems do what they can. Systems also have a lot of bureaucracy and a lot of lack of willingness too. The systems have existed for quite some time to provide intensive treatments for young people, as well as less intensive treatments. So for instance, in my practice, I see young people every day in an outpatient setting, which is a reference to they live at home and are going to school and living their lives, and they come once a week for an appointment or more often. There's also a step-up level of treatment where they can go to day programs and in fact also even attend school in settings where they're receiving treatment. And then there's the more intensive treatment, which is to be in a residential treatment setting. And we do have a residential treatment setting programs for youth and adults all across the province. There's always going to be a greater need than the demand. That goes for our mainstream hospital systems as well. And we certainly hope that there will be increasing response, not just for the opioid crisis, but I know we're going to see a lot more youth seeking treatment also around cannabis use issues and disorders. So there's a lot of discussion about trying to create more access to treatment.
Yeah, there's always a need. Candace McFadden says, I'm an opioid addict for 11 years, clean for 7 years. I would be dead without marijuana. It handles cravings like a dream. What is your opinion, doctor?
Certainly that's an option, and I've discussed that with many people, mostly in my practice, but also in my personal life. And for some people, it's a great option. Not everybody wants that option. I think we should have options that suit each individual life, each family system, each community system. There are community systems where they don't necessarily want to take that as an option. It's far less dangerous than opioids. And it can be a harm-reducing option to take for recovery. Ultimately, I think we all deserve to live a life the way we were originally designed, and that is to find joy and connection and fulfillment in our lives, not requiring any particular substance. And if one makes a choice to use a substance, fine, as long as we're not harming others, and if we're reducing the harm for ourselves, which is I think what this person's asking, using this as a harm reduction model, and that's fine, that's great. That's different if it's a 14-year-old asking that question or a 16-year-old who still has a developing brain. But if that's the difference in a 16-year-old who has a deeply entrenched addiction to opioids, and that's the most harm-reduced option that they can take, great. But ideally, I'd like to see young people having their brain development and their life development and their emotional and spiritual and physical development unencumbered by any substances, including what I would write on a prescription. So, but this is a great choice for her. I totally support the choices, you know, that people can make.
I guess this is more the medicinal use of marijuana, I suppose.
I suppose I would call it a harm reduction approach,
Carrie Bennett says, users could be treating an underlying symptom like anxiety or another problem.
Absolutely. Self-medicating is a very common phenomena in the human species, and I think they've done it long before I was ever born, and will continue to do it to the end of time. So self-medicating is very common, and it's not always with opioids. Some people do it with a bucket of ice cream. Some people do it watching a lot of TV. Some people do it by working 100 hours a week. So people self-medicate, humans self-medicate their internal experiences. And ultimately, hopefully, you know, each one of us is given the opportunity to live our lives without requiring, again, I'm saying the same thing, without requiring something to soothe what's internal, and can find those resources within us. Ultimately, and this comes from a physician, so it's, you know, take that with a grain of salt. Ultimately, the best medicine is within us. It's not in a joint, and it's not in a bucket of ice cream, and it's not on the TV screen.
You know, we're going to wrap up shortly here, but I have another question, and because this is, you know, a focus on back to classes and so on, we've talked a lot about what parents can do and all that, but what about in the classroom? What about the educators, the administrators? What about the leaders at school? What do they do? How do they sort of help out kids who may be one pill away of ingesting it? And
yeah, you know, as I said, my son and my daughter are both off back to school, and I hope that in these milieus of the orientation weeks where there's lots of partying, but even throughout the school year, that the leaders in the school systems are bringing awareness to this issue, whether they be healthcare providers within the school systems or their leaders or their educators themselves. And I hope that the youth themselves will take on their education around this, whether they're reading print paper anymore, which not too many of them do, or they're reading it off a screen. They know that these deaths are happening. They know from their own peer groups that kids are dying. And this is not just young people who have addiction disorders. This is young people who are using an OxyContin when they go out to a party, and, you know, then somebody finds them in the bathroom slumped over on the toilet. So the kids have the experience themselves, and they can educate themselves, as well as the systems and the educators and the school systems. And, you know, some systems have taken incredibly innovative and proactive responses. I have a colleague, a really dear and gifted colleague up in Thunder Bay, who's a nurse practitioner and ran for already a number of years a treatment program right in the school program. So this is for Indigenous youth in the far northwest of Ontario who come down from their remote communities and study in Thunder Bay, some of whom were affected by opiate use and opiate use addiction. And she was providing these services right in the school in the context of primary care and giving them treatment for opiate use disorders. She's so good at what she does. Those kids are so brilliant at what they do that they put themselves out of business. They ended up closing down the program because the kids literally graduated from high school and graduated from their treatment programs and have moved on. Of course, some of them are still struggling with recovery, but many of them have no more problems with their opiate use.
What a fantastic, positive thing to hear. Thanks for sharing that story. And we do have another question. Jordan Carol Beaulieu French-Canadian obviously, asks, is there any services available or ways to test drugs to detect the presence of fentanyl or other dangerous adulterants in drugs?
You know, I'm sure the police and the forensic systems have ways to test what's in the powder that they're seizing. As far as products that are available to the everyday user, I'm not familiar with any. I'm familiar with a lot of discussion and the attempts to do so. I know my colleagues at CAMH are able to test some of the substances, but I'm not aware of a product that's available to the everyday consumer. We've certainly had that for MDMA products in the past and for other substances, but there probably is. I haven't seen the product, and I don't know of any of my patients who are using it. The best product is caution.
Yeah, I was going to say, how would that work practically? You know, if some student is offered some, you know, questionable pill, I mean, I don't know. How could you test right away if it's?
Well, you know, that's not my area of expertise to create that kind of manufactured product. I'm sure we could, and it could give some assurance. But even if it tests negative and it turns out to be positive, I know in our testing, in our urine drug screening in my patient population, they're coming up negative for any opioids. But as it turns out, they have had an opioid, and it's an opioid that we can't yet test for.
Right.
So a carfentanil product would be an example.
Yeah, I've heard from other doctors that it's very hard to test. Right, the urine samples, the blood tests, very hard to detect. So it's always hard to find out if this person has died of an opioid overdose because of the testing. Anyway, we're in the neighborhood here, so there's lots of activity going on. Look, this has been a fascinating discussion. I know I've learned a lot, and I'm a health reporter, so I really appreciate your input today, Doctor. And I appreciate everybody who's just had fantastic questions, and I thank you, and you know, maybe we'll see you another time on another CBC Facebook Live. I'm Kas Rousy, and get back to school and have a good school year. Thank you. That's good. I'm glad you talked about that last thing, that your friends there in North Bay, because I want to do that story, so I don't want anybody else to do it. So I think that would be, we're still actually in front of the